Cataracts develop as part of the aging process. By age 75, about 70% of people will have cataracts. With age, our eye's lens blocks vision and slowly becomes less flexible and transparent. Then areas of the lens become cloudy as protein begins to clump together. There are many misconceptions about cataracts. A cataract is not a film over the eye or caused by overusing the eye.
A cataract is nothing more than the lens inside the eye, the human eye, that gradually loses its clarity as the eye ages. There are many types of cataracts, but they all eventually wind up blocking the patient's vision and causing blurred vision for them.
Cataracts are mainly caused by aging. And some of the other factors that can play a role are sun exposure over the years, and occasionally certain medications can accelerate cataracts, but for the most part it's just caused by the passage of time.
The earliest symptoms of cataracts would be typically glare at night, especially from headlights when lights are coming at the eye. Other symptoms are just gradually blurrier vision, needing more frequent glasses updates to see well. And then eventually the vision declines to the point that activities of daily living are impacted or limited, and eventually lifestyle becomes limited.
Cataracts for the most part cannot be prevented because it is an age-related process. Eye protection in the sun can be helpful, and if someone is on a medication associated with cataracts, then you do want to monitor that.
When you are noticing any significant vision change, it's a good idea to have an eye exam and be seen. You can't assume it's cataracts. But if you know you have cataracts, it's a good idea to be seeing fairly regularly, say once a year.
Since most cataracts are part of the normal aging process, they cannot be reversed. There are no medications or eye drops that will make cataracts go away. Surgery is the only treatment. Before surgery, the surface of your eye is measured using a topographer. The length of your eye is measured using an IOL master, and the curve of your cornea is measured in a technique called keratometry. These measurements help your ophthalmologist select the proper lens implant for your eye.
Cataracts are treated with cataract surgery. Once the patient's vision has declined to the point that it is limiting their lifestyle and their activities. Cataract surgery is very refined. It's nowadays done in about 15 minutes painlessly, awake with the patient relaxed with the help of medications. Typically, there are no needs for sutures. What occurs is in the eye, the cataract would form here where the lens is, and the surgeon will go in through a 2.8 millimeter incision, remove this lens while maintaining the structure inside the eye. And then a lens implant will be inserted through that 2.8 millimeter hole that will deploy in the eye to a total of 12 millimeters in diameter. And it will replace the lens. It's essentially a part replacement surgery.
An IOL is an intraocular lens, and it's the replacement lens when we do cataract surgery. People lots of times think that a cataract is a growth on the surface of the eye that's come across, and that's not the case. The artificial lens that's put in, the intraocular lens, is clear and replaces the natural lens and restores clear vision. A specialty IOL is an IOL or intraocular lens that is trying to not only replace the natural lens of the eye and give clear vision, but is also trying to replace the glasses, at least to some degree, and in that way allow someone to be less dependent on glasses after cataract surgery than they were before.
There are several different technologies and types of these lenses, and depending on the type of eye you have, one or more of those technologies may be appropriate for you. We implant all of the latest technology here at BMC, and those patients who are interested have access to the latest technology.
A cataract may not need to be removed right away if your lifestyle isn't significantly affected. But it is important, once diagnosed with a cataract, that your ophthalmologist monitors your vision regularly for any changes. And remember, while cataracts are one of the most common causes of vision loss, especially as we age, they are entirely treatable. For Ben Memorial Clinic, I'm Victoria Adelis.